We can now use some of this information that we just talked about and think about what kinds of clinical manifestations we would have. First, talking about injuries at the segmental level, we've already said that C5 and C6 injuries are going to affect muscles in the proximal region, and that's what all these muscles are. And so we would expect to see losses of flexion of the elbow, and a test for that would be a biceps tendon reflex. And of course, since 5 and 6 are the components of the upper trunk, you can injure those two segments with an upper trunk injury. We said C8 and T1 is another segmental level in which you could have injuries. We said that the muscles affected are going to be in the distal limb, in other words, hand muscles, and that's what you'd expect to see. And since C8 and T1 come together to form the lower trunk compression would cause a C8 and T1 injury.